Hey there, girly. It's Coach Kristen here. Today, this module, we are going to cover practicing for our TDLR test. Okay, so remember, we have to go and take a written eyelash extension test, and then we also have to take a practical eyelash extension test. Okay, so today we're going to help prepare you for your written exam. So everything that we're going to cover today is everything that is and will be covered in your test as well too. So very important that you understand all this information. As always, if you have questions, concerns, shoot me an email or hop on the Wednesday coaching call, and we will, like I said, get you prepared and everything. But it's really easy, okay? So don't be fearful. A lot of the information is very, very play-by-play, and a lot of this stuff you've already learned and covered within our earlier modules, okay? So just make sure to pay attention to everything that we're going to cover. Like I said, if you have any questions, let me know, all right? So anyways, let's go ahead and dive in. So, conjunctivitis. Conjunctivitis is an inflammation of conjunctiva due to bacterial or viral infections. Symptoms may include the following: redness in the white of the eye or inner eyelid, more tears than usual, thick yellow discharge that crust over the eyelashes, especially after sleep. Green or white discharge from the eye. Burning eyes can also be a sign of conjunctivitis. Blepharitis. Blepharitis is an inflammation of the eyelids. Blepharitis usually affects both eyes along the edges of the eyelids. This may also be caused by a surplus of demotic mites. Symptoms may include watery eyes, red eyes, a burning or stinging sensation in the eyes, itchy eyelids, red swollen eyelids, flaking of the skin around the eyes, crusted lashes, and sensitivity to light. Okay, contact dermatitis is a skin reaction due to an exposure to an allergen or irritant. Symptoms may include redness, swelling, rash, itching of the skin, blisters, or scaling of the skin. Corneal abrasion. Corneal abrasion is a scrape or scratch on the cornea. It is a common eye injury. Abrasions can be very painful and uncomfortable until the cornea regenerates itself. Symptoms may include redness, excessive tear production, uncomfortable feeling on the cornea. Oscular rosacea. Oscular rosacea is an inflammatory condition which can affect your eyes and eyelids. Symptoms of ocular rosacea can include bloodshot eyes, pink eyes, stinging or burning eyes, itchy eyes, dry eyes, teary eyes, redness and swelling around the eyes and on the eyelids, crust on the eyelids or eyelashes, the feeling of having something in your eye, blurred vision, light sensitivity, blocked and inflamed glands. Okay, now we're going to cover our growth phases. So we have anagen, which is the growth phase. The anagen phase is also called the growth phase. These lashes are actively growing. This phase lasts between 30 and 45 days. Only about 40% of the upper lashes and 15% of the lower lashes are in the anagen phase at any one time. Each lash will grow to a specific length and then stop. Okay, then we have catagen, which is the transition phase. So catagen, the transition phase, the catagen phase is also known as the transition phase. During this phase, the lashes stop growing and the hair follicle shrinks. Then we have telogen, which is our resting phase. So during this phase, the hair is no longer attached to the dermal papilla and it sits dead in the follicle until it falls out again. Okay, so we have covered our growth phases of the lashes. Make sure you understand this because they will ask you about the different growth phases. What is isolation? Isolation is the process of keeping one single natural eyelash set apart from its neighboring lashes by using two tweezers to push aside lashes to the right and left. No neighboring lashes should be in contact with the isolated natural lash. Contamination. Contamination is the presence or the reasonably anticipated presence of blood or other potentially infectious material on an item, surface, or visible debris or residue such as dust, hair, and skin. Bacteria. Bacteria is a single-cell microorganism that have both plant and animal characteristics. Some bacteria are harmful, some are harmless. Disease. Disease is an abnormal condition of all or part of the body or its systems or organs that make the body incapable of carrying a normal function. Okay, then we have non-porous. Non-porous is an item that is made of a material that has no pores or openings and cannot absorb liquids. Sanitation is also known as sanitizing, a chemical process for reducing the number of disease-causing germs on clean surface to a safe level. Sterilization, the process that completely destroys all microbial life, including pores. Okay, so sterilization and sanitation are completely different, so make sure you understand the difference. Infection control. Infection control is the methods used to eliminate or reduce the transmission of infectious organisms from one individual to another. OSHA. OSHA is the Occupational Safety and Health Administration. OSHA was created as part of the U.S. Department of Labor to regulate and enforce safety and health standards to protect employees in the workplace. OSHA standards address issues relating to handling, mixing, storing, disposing of products, general safety in the workplace, and your right to know about any potential hazardous ingredients contained in the products and how to avoid the hazards. OSHA also requires that chemical manufacturers and importers assess and communicate the potential hazards associated with their products through a safety data sheet, an SDS, a 16 category standard format document. Okay, so you will need to keep a safety data sheet on you as well too. This is mainly whenever you have like a full salon. If you're operating out of you can have one in your room as well too, your private suite, and most of the time you just mark like when you cleaned, how often you changed your barbicide, things like that. Okay, so eyelash extensions consideration for different eye shapes. So remember we covered our eye shapes, and we also covered what lashes would work best with them. So if you are having trouble remembering this, make sure and go back to that mapping module, and we kind of dug in really deep on the different types of lash maps. But again, we're going to cover these again because you are going to be tested on this whenever it comes to you going and taking your test. Okay, so remember, deep set eyes. For deep set eyes, choose slightly longer and curlier than normal lash extensions, okay? For protruding eyes, balance the eye by choosing somewhat shorter extensions. For wide set eyes, slightly longer extensions near the inner corner of the eye, okay? Closed set eyes, use the longer extensions at the outer corners of the eyes. This will give the illusion of width. Almond-shaped eyes, to make them appear larger, add longer extensions to the center of the eye. For round-set eyes, add longer extensions to the outer corner of the eyes to give them a slight almond shape and give them balance. Okay, now let's cover some face shapes. So for face shapes, okay, if you have a square face shape, adding longer extensions near the center of the eye, drawing attention away from the sides of the face, is how you will do a square face shape. Round face shape needs more vertical lines, so add height by focusing oblong extensions around the middle of the eye. Oblong or long face shape, the most flattering style would be a cat eye. Focus on long extensions on the outer corner of the eye. Triangular face shape, apply a full arrangement of extensions with enough length and thickness to give a sense of width to the forehead and top of the face. Okay, so like I said, if you have questions I know I went through it, pretty fast. It's pretty standard, okay? And we are going to have multiple of these modules to go through about different test questions they could ask you, and what the answers are to correctly for each of these. So like I said, this was just a general video to show you what can be and what will be on your written exam for your eyelash extensions, okay? So like I said, just watch this again. I went through it pretty quickly. Like I said, it's pretty standard, pretty basic, and we've already broken down each of these things in all of our sections previous to learning. So like I said, if something's really not making sense, head over to that module and then also send me an email. But yes, make sure, like I said, you watch each of these modules as we go through. That way you can, like I said, prepare for your test to the best of our ability. It's going to be very easy, so don't freak out. Don't stress out over this. I know I keep saying it, but it's because it's true. It's going to be really easy. So, like I said, just study this material, watch this again, and like I said, if you have any questions, let me know, okay? All right. I will see you on your next testing module.